Back pain can be caused by many things. Those discs can bulge out or herniate, and they can pinch off nerves. Those joints can become very arthritic and inflamed. Sometimes it's just wear and tear, and sometimes it's a specific injury. And initially we try conservative treatments, but when the pain persists, then spinal cord stimulation is a great option. It is one of the few procedures where you can try it out before anything permanent is done. That's actually done here in the office. We place those tiny, soft, they're almost like pacemaker wires. We tape a battery to your back and you go home. There's no surgery. About 80 to 90% of our patients get 50 to 100% relief. If the trial is successful, we then proceed to the permanent implant. This takes about an hour and a half, so we can place a very small battery, very thin. We put a couple of stitches in there and that heals very quickly. A spinal cord stimulator involves placement of two tiny plastic wires that are very soft and have small metal electrodes on the end. And in the same way that a pacemaker emits a tiny electrical signal to cause the heart to beat a certain way, this can send tiny electrical signals into the spinal cord to change the way the body processes and sends pain signals to the brain. Once you turn on the stimulator, just the pain melts away. You don't feel anything else. So we don't need to be operating on the spine itself. It's much less invasive than other surgeries. If one day you don't need the stimulator anymore, it is certainly a reversible procedure. It just takes 20 or 30 minutes and it's as if it wasn't there. So spinal cord stimulators come with a little remote control to change how much stimulation you're getting, where it's stimulating, what kind of stimulation you're getting. After the healing period, which takes about 4 to 6 weeks, you should be able to do whatever you like. You can go back to playing tennis, running, traveling. That really helps them actually maintain better back health. Someone who has peripheral neuropathy, there's data that shows that spinal cord stimulation not only makes that pain go away, but it helps those patients recuperate the sensations that they've lost. There's a wide variety of anesthesia options. Some patients do it completely awake. Other patients just take a little bit of oral sedative like a Valium or a Xanax. And for other patients, we can do it with IV sedation at the surgery center. Some batteries are non-rechargeable. They tend to be a little bit bigger. Every few years, they need to be replaced. We don't need to replace the whole system, just the battery. These smaller batteries can be recharged every day through the skin, wirelessly. You put a small magnet up to it and it recharges through the skin. Much like an Apple Watch, same thing with these batteries. In the old days, you'd come in with back pain and we'd say, well, let's adjust your spinal cord stimulator so that you can go for this 5-mile walk. Now we can measure that a patient in Massachusetts had their stimulator adjusted for a 5-mile walk, and another patient in California and another patient in Michigan. We feed all that information into a computer and using artificial intelligence, and it'll push that stimulation parameter out so that it affects all patients. Most of the data is kept on the battery itself. All of this is completely up to the patient as to what data is shared and what data is not shared. We are some of the first doctors to implement this technology in Fort Bend County and in Sugar Land and Missouri City. We here at Texas Pain Care feel very fortunate that we can offer this to the community here. Visit our website, www.txpain.com. There's a lot of information there about spinal cord stimulation and treatment options. You can call us at 855-748-7246 or make an appointment on our website at www.txpain.com. And we're happy to just have a meeting and share information with you, chat with you and see if it's a good option for you.